Hello and welcome to the COVID-19 update on Channels Television. Here's what's coming up in the next 30 minutes. A tertiary institution in Yobe State is now to give its students COVID-19 information at the start of each lecture period. The Ekiti state government debunks rumors that state-run tests come with a fee. Plus, the UK government says all NHS workers must be vaccinated against COVID-19 by April the 1st. Thank you for joining us at this time. I'm Layo Adegoke. Let's begin with the latest figures from the Nigerian Centers for Disease Control. Cross River State had 13 COVID-19 infections last night. It is the highest number for the 24-hour period. It was closely followed by Lagos. The NCDC confirms that new positive cases came out of 8 states and the Federal Capital Territory. Meanwhile, the FCT still has the highest number of COVID-19 patients on admission. Here's more on the NCDC update.
Additional persons in Nigeria have been recorded as positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT and indicate a drop from figures reported 24 hours earlier. Cross River and Lagos reported 13 and 12 cases. Enugu had 8 cases, Plateau had 7 cases, Rivers had 5, and the FCT reported 3. Bauchi State reported 2 cases, while Abia and Kano reported 1 each. The total caseload in Nigeria has risen to 212,765. Today's report of discharge cases reflects the correction of a computational error, bringing the figure to the total recoveries of 204,261. There were no additional deaths from COVID-19 complications reported in the last 24 hours, keeping the total number at 2,906. Currently, there are more than 5,000 active cases in Nigeria, while over 3.3 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that more than 5.7 million Nigerians have received a first shot of a COVID-19 vaccine, while over 3.1 million persons have been fully vaccinated. Globally, more than 7.3 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 219,000 deaths recorded across countries on the continent. More than 250 million people all over the world have contracted COVID-19, while deaths are over 5 million.
In northern Nigeria, the Vice-Chancellor of Yobe State University, Professor Mala Daura, has asked all lecturers of the institution to daily allocate 3 minutes of their lecture periods to sensitize students on the significance of taking the COVID-19 vaccines so as to curb its spread. He made the disclosure at the flagging off of the COVID-19 town hall meeting and sensitization for students of tertiary institutions across the state at the Yobe State University, Damaturu, the state capital.
When COVID-19 took hold in Nigeria, communities, government and religious houses undertook safety measures and risk communication to minimize its spread. Such efforts were almost absent in some learning institutions owing to school shutdowns and lockdowns. Now the Yobe State Primary Healthcare Management Agency is holding a town hall meeting and sensitization of students' tertiary institutions across the state.
We felt that we can actually have a double-edged victory when we engage the university community. First, for us to actually sensitize and advocate for increased uptake of the COVID-19 vaccination among students and staff. But we also think that secondly, we can have a secondary benefit of actually using these students and staff of the university as advocates.
The Vice-Chancellor of the Yobe State University is asking all lecturers to set aside 3 minutes daily to sensitize the students on the importance of taking the vaccine, a move the President of the Students' Union government is in support of.
This will now ensure that our students, which are over 10,000 of them in this university, will be vaccinated. So the staff too need to be sensitized So this particular exercise that we have just carried out, I think is going to send a signal that the COVID-19 vaccine is a necessity to both students and staff.
We had the sensitization on COVID-19 vaccination organized by the Yobe State Primary Healthcare Management Board inside the Yobe State University at Gaidam Hall. I found it very encouraging. Vaccination is very, very important for our own health.
The Vice-Chancellor hopes that each of the over 10,000 students will turn up to be vaccinated, thereby creating a safe space for learning and serving as an example for other communities.
The Ekiti state government is debunking claims that COVID-19 tests being run by government is now being heavily paid for. The Ministry of Health states that tests run by it are not being paid for, as the ones being paid for are those undertaken by private facilities. Meanwhile, the state says it's still running COVID-19 tests despite a decline in the state's positivity rate.
We have expanded our testing centers to 145 testing centers across all the local governments. The state has 177 wards, so we had already expanded our testing. So we do RDT testing in some of our facilities, both at the primary and secondary care, and of course tertiary care. So we are still running tests, even though our cases have really dipped since the third wave had subsided significantly. But we still run tests, okay, and we still have pockets of positive people. The test that the Ministry of Health does is not being paid for. We have we run the PCR test through our molecular laboratory and also the RDT test, which is completely free, is not being paid for. But the test that is being paid for is not run by the state government. The NCDC in Abuja had already, they reviewed, and they've reviewed that protocol, and they have mandated some private organizations to be able to take tests for a pre-travel test and post-travel test, like a pre-travel test and an arrival test. And that is already now in the hand of some private individuals, that runs that. So some of those private individuals have been accredited by the NCDC to conduct those tests, because there were a lot of issues when government was running. The government could not really sustain it because government was spending a lot of money to run the test for free. Now it's in the hand of the private and it's not in the hand of government, especially the pre-travel and arrival test.
Well, joining us via Zoom is a public health consultant, Dr. Doyin Odubanjo, for more discussions. Thank you for your time. Let's begin with your opinion of the vaccine mandate in Nigeria. How well would you say the country has fared?
Well, I would say that in terms of controlling the pandemic itself, we've done relatively well. But I think the mandates are premature and perhaps unnecessary. So we need not go down that route. We should be looking at engaging people about their concerns and telling them the benefits of taking the vaccine. Primarily because the science to back the policy of mandatory vaccination is not as sound as we would wish it was. The evidence is not as strong as we would wish it was, and I think that the government should be reluctant to go down that route yet. Because you'll find out that the places that have achieved high vaccination rates are not doing nearly as well as Nigeria, for instance. So places like Israel, like the UK, they are still reporting thousands of cases a day. We reported under 100, and they are having deaths in the thousands or sometimes hundreds to thousands. So they are not doing as well as we are. That also questions the fact that the behavior of this pandemic in an environment like ours is clearly different. And so our response should be clearly different from what is being done abroad. You will also find out that at a point, I think the US was the first to jettison masks, as it were, but they went back to putting on masks. Why? The evidence pointed out that those who are vaccinated can transmit, which is the basis for which mandatory vaccination is being put up, is the case of people's liberties. You can't trample on somebody else's liberty by infecting them. However, if the evidence suggests that those who are vaccinated can transmit, then it means that does not hold any water, and you can't ask people to be mandatorily vaccinated in order to protect others. It means they're not really protected. So it means that my vaccination protects me much more than it protects me or it protects others from getting infected through me.
Well, several states in the country are planning to vaccinate millions of their citizens before Christmas. How feasible do you think this plan is, seeing as there are just over 3 million vaccinated people in the whole country?
Well, I think it's an ambitious goal. Sometimes you set an ambitious goal hoping to drive, action, but I don't think it's achievable. Particularly because the available vaccines are not being taken up as quickly as you would want because of the well-known vaccine hesitancy, and we are not addressing the real reasons behind the hesitancy. So in a country like Nigeria, I'll be wary of the fact that people will suddenly or could suddenly start showing up with vaccination cards that are not genuine. And there are many ways around that. So I'll be more concerned that if you push it, that is what is likely to happen. People will have the cards, and they will have the real cards sometimes, but they will not have the vaccines. They will not have taken any vaccination, and then we'll be in a bigger problem. So I think setting those goals, they are good for motivating, the health system to try to get things going. But it should motivate us to engage the populace better first.
Well, speaking of motivation, what would be your suggestions of, the way forward?
Well, we need to drill down to the communities and and have, roundtable engagements with people. And this time around, not top-down engagement or top-down discussions, but bottom-up. So we need to be asking people, why not? Why don't you want it? Why won't you take it? And in each of such engagements, and mind you, we have such arrangements in every community. You'll have ballets here. You have, CDA chairmen and CDA groups there. So we need to just drill down and do the hard work of reaching those people and then asking questions in such forums to say, why not? Let them tell us why not. And then let there be experts there who can answer their questions or who can speak to their reasons why they are hesitant to take it. If we're able to do that, we would indeed get a lot more people. Many more people would take the vaccines, I believe, because you have spoken directly to their concerns. But if we just stay off on TV and tell them it's okay, it's fine, it's safe, it's this, go and take it, I think we'll be missing the point. And we'll be missing the opportunity to engage the people effectively, which is not just for the now. If we do it right now, next time we need to engage the people, we will find it easier to do so. The people will also trust in the authorities and the experts better. That maybe then they will just respond to whatever I said on the TV.
Well, speaking of engagement, in Yobe State, we know the Vice Chancellor of the State University is asking all lecturers to now daily allocate time in sensitizing students. Of what impact do you think this would have? Perhaps this should be replicated in all schools?
Well, it could be impactful. It depends on how it's done, and it depends on who is doing it. So again, if you are there to lecture the people and just talk to them and tell them all the things that they've heard before, you may not change their minds about anything, because primarily why people do not obey authority largely is about trust. So you need to hear them. They need to say what is on their mind. You just don't come and talk to them and give them another lecture, but you need to give them the chance to say what's on their mind, and you need to use the right messengers. Okay, so the message is just as important, or the messenger is just as important, perhaps more important than the message itself. So you need to find the people that are trusted, believable, the experts, and let them be the ones to address the people, not just that the dean will talk to them or the HOD will talk to them. They don't necessarily, believe the person. And worse still, when it comes to politics and politicians, so it's unfortunate. It's not that every politician is bad, but it's unfortunate that is how the world runs. So you need to find the experts, you need to find the healthcare workers also, that these people put their lives in their hands all the time, and let them be the ones to come and talk to them and answer their questions.
All right then, Dr. Doyin Odubanjo, public health physician, thank you so much for speaking to us.
My pleasure.
We'll take a short break now. Please stay with us. There's more after this time out. Welcome back to the program. The federal government has approved 5 billion naira for the construction of a new teaching hospital at the permanent site of the newly established Federal University of Health Sciences, Ekiti Akpa, in Otukpo local government area of Benue State. The Minister of Education, Mr. Adamu, who was represented by the permanent secretary, Mr. Sunday Echono, disclosed this in Otukpo during the maiden matriculation of the institution, noting that the COVID-19 pandemic clearly shows the need to produce more doctors and other health workers, researchers and nutritionists to support the sector. Explaining further, the Vice-Chancellor of the Medical University, who doubles as the President of the Nigerian Medical Association, Professor Innocent Uja, said the doctor-patient ratio is about 1 to 6,000, and the figures are worse in northern Nigeria, underscoring the need to invest in the sector ahead of any medical emergency.
Professors of medicine and top government officials adorned in academic robes for the maiden matriculation of 230 students of the Federal University of Health Sciences, Otukpo, as the university officially takes off. Among the guests is the Permanent Secretary, Federal Ministry of Education, representing the Minister, Adamu.
Including but not limited to.
After the oath taken by the students and the message of assurance to create an enabling environment for their students, the Minister disclosed that 5 billion naira has been approved for building a new teaching hospital that will provide research work for health challenges.
The COVID outbreak exposed some of our weaknesses in terms of personnel, in terms of equipment and facilities in our response to such emergency. So we decided that we should use this opportunity to build, to establish institutions that will produce the right manpower to respond to future such emergencies.
He also revealed that 2 additional specialized institutions in Bauchi and Osun to complement efforts at the medical university to support the fight against COVID-19 has been established. Reacting to these developments, one of the matriculation medical students out of the 100 that got admission says she will embrace the opportunity to learn in the circumstance.
I'm privileged to be a student of this prestigious university, and the pioneer said I'm very, very happy, and I hope to do my best.
Thank you so very much for coming.
At the end of proceedings, the Vice-Chancellor, who is also the NMA President, explains the need for a medical university.
So there is a need for a medical university. The production and, of course, the quality of production of our doctors will help to stem the tides and also improve quality of healthcare services in Nigeria. There's no two way about that. And it's even better too, because we spend so much foreign exchange to train even medical doctors outside. And it is less expensive to train in Nigeria. We know training of doctors is very, very expensive.
Finally, the first specialized medical university established to train doctors has already taken off. Sister institutions in Bauchi and Osun will be training nutritionists, nurses, and pharmacists to complement efforts from Otukpo in Benue State, all in a bid to prepare for any medical emergency.
Well, let's check in with stories outside Nigeria. Almost 100,000 NHS workers in England are unvaccinated, but under new government guidelines announced earlier today in the House of Commons by the British Health Secretary Sajid Javid, this is all set to change. Well, this latest bombshell announcement follows a similar stance taken by authorities in France, Italy and the US. Governments in these nations have also ordered healthcare workers to get vaccinated, despite critics calling this a breach of human rights. In a separate mandate, Thursday is the deadline for social care workers in England to get vaccinated or they lose their jobs. The tough talk has raised eyebrows from all quarters, but Prime Minister Boris Johnson's government is relying on vaccinations, including booster shots for the vulnerable, to avoid winter lockdowns, having already shut down the economy 3 times. Britain is still grappling with COVID, with over 142,000 deaths. The government is attempting to do all they can to ensure the virus gets under control. Well, our channel's TV correspondent in London, Juliana Olayinka, joins us now for more. Hello, Juliana. How are people reacting, people in the NHS and even others reacting to the news of this vaccine mandate?
Good evening, Alaya. Well, there's mixed reactions, I think. The announcement has just taken place a couple of hours ago by Javid, and it's been a long time coming. As you just outlined there, social care sector were the first big group within the UK to have these rules enforced, and we've seen similar movements been taking place in France, Italy, and America. I think here in the UK, though there is a small but loud anti-vaxxer movement, as it's called, I think most people understand and agree with the government that making sure as much of the population is vaccinated as possible is the only way for us to get out of this sticky situation that we found ourselves in. Over 146,000 deaths here in the UK. That is one of the highest death rates, not only in Europe, but across the world. And I think the idea of a lockdown scares people to their spine. So I think people do understand that vaccines are the only way. But I think the crucial point is that must you be forced to do so? Must you be forced to lose your job if you don't? So I think we are going to get a series of criticisms, possibly even from the Labour Party at the next Prime Minister's questions in the House of Commons next week, saying, whether or not, this should be allowed to go ahead.
Well, on Monday, the US opened its borders to fully vaccinated people. How are people in the UK taking this news, of opening of the US international borders? And what will be the new rules for traveling going forward?
Gosh, the rules change all the time. So I suppose I would have to say anybody willing or wanting to travel with their airline. But of course, Monday was an absolutely monumentous day. Transatlantic flights are right in the heart and the centre of British travel, especially for the flagship air carriers like Virgin Atlantic and British Airlines. They have been relying on this US travel corridor to be open. So now if you are a fully vaccinated Brit, you can travel to America. If you're under the age of 18, you will be exempt, although you would have to, of course, make sure you can supply a negative COVID test. This is wonderful. According to those within the travel industry, already this month, in the month of November, there are over 3,000 flights booked between the UK and America. This is still about 50% below what you would have in an average November pre-pandemic. But, this is a good start. About 70% of British Airways revenue relies on that pretty lucrative corridor between London Heathrow and JFK. But a lot of the bosses are slightly concerned about business travel. Lots of people are reliant upon Zoom. That's what we're doing now. Businesses have been comfortable. They're looking at their bottom line and they're saying, do we really need to put somebody on an £8,000, business or private class flight when they can have the same conversation? So that's really what the airlines are looking for. But of course, in the major markets, all of the airlines, including IAG, the parent company of British Airways, Virgin Atlantic, all of them were trading much higher. And they were, a sigh of relief once that famous corridor opened its doors once again.
All right, then. Thank you so much, Juliana. Well, let's take a look at other latest developments from around the world. Like we've mentioned, the UK government has confirmed it will make COVID-19 vaccines compulsory for frontline NHS staff from April 1st next year. Plus, Russia's daily COVID-19 death toll hits new record high. Here's more in this global update.
Thank you, Mr. Deputy.
Speaking in the House of Commons, UK Health Minister Sajid Javid announced the health workers will have to be vaccinated against COVID-19 by April 1st, making it a mandatory condition of employment for those on the front line of the National Health Service, NHS.
I have concluded that all those working in the NHS and social care will have to be vaccinated. We must avoid preventable harm and protect patients in the NHS, protect colleagues in the NHS, and, of course, protect the NHS itself. There will be two key exemptions. One for those who don't have face-to-face contact with patients, and the second for those that are medically exempt.
The move follows a similar decision to make COVID-19 vaccines compulsory for care home workers, which comes into force on Thursday. Other countries like France, Italy, and some US states have also ordered healthcare workers to get vaccinated. In other developments, Russia has reported a record daily COVID-19 death toll of 1,211, just one day after a nationwide workplace shutdown aimed at curbing a surge in cases was lifted across most regions. Measures against coronavirus have been tightened all over the country. It includes disinfection in transport, taxi and public places, and an increase on the infection testing system. New Zealand beefed up security measures at its parliament today as thousands of people gathered to protest against COVID-19 vaccine mandates and government lockdowns. New Zealand has struggled to fight off a highly infectious Delta outbreak this year, forcing Prime Minister Jacinda Ardern to move from its strategy of elimination through lockdowns to living with the virus with higher vaccinations. And finally, there were emotional scenes on Monday night in the United States as families separated by COVID-19 travel restrictions finally reunited. Adherence to all non-pharmaceutical preventive measures of COVID-19 will help curb the spread of the pandemic. Please take responsibility, and vaccine alone and not enough to keep the pandemic away. Visit our website channelstv.com for more updates and better understanding of the pandemic, plus other stories. It's all at your fingertips. Well, that's the COVID-19 update. Thank you so much for watching. I'm Layo Adegoke.